Hello, this is Dr. David Green, Education Director for Premier Pain Specialists in Chicago. The topic today is my hip pain coming from a hip or lumbar spine problem. Hip pain is very common. Millions of Americans suffer from hip arthritis, with the pain potentially causing significant disability, limited ability to walk and exercise. There's about 300,000 total hip replacements performed every year, and the pain, when it's occurring in the hip area, it just seems obvious to feel like it's occurring from the joint itself. But it may not be the case. When pain is being felt in the hip, it may or may not be coming from a hip joint problem. There can be an overlap in symptoms between hip arthritis and lumbar spinal stenosis. As we age, spinal stenosis is extremely common, just like hip arthritis, and both can occur due to degeneration. Here's a cartoon of spinal stenosis. It occurs with degeneration of the intervertebral disc, which can lead to, so here's the disc. As this breaks down, more stress can be shifted to the back of the spine where these facet joints are. That's where one vertebrae hinges and articulates with the next, okay? And that can cause bony and soft tissue overgrowth, which then can pinch spinal nerve roots and lead to pain in one's buttocks, legs, or the hip. And the hip pain that's experienced from spinal stenosis can mimic that from arthritis of the hip joint. So how to differentiate between the two? Here's an example on an MRI where you have some disc degeneration and some bulging, and you have some arthritis back here in the facet joint, and the result is pinching from behind and from the front, and it decreases the space available in the spinal canal. You can see that on this cartoon here, okay? Here's a pelvis X-ray where you have a normal looking hip over here. You see how this is sort of a spherical femoral head, nice joint space. And then on the arthritic side, it's really hard to see the joint space at all. And this whitened area shows that the bone is getting hard due to the arthritis. There's some cysts in here. So how do you differentiate? Well, first would be the history, the area of the pain. If the person is, pointing down the thigh, or on the outside of the thigh or the front of the thigh, it could be either. I mean, hip arthritis can have pain that radiates, and so can stenosis. If a person's having pain directly over the hip joint, that's a little more geared towards hip arthritis. Duration, when does it come, when does it go? On physical exam, if you have point tenderness right over the hip joint, that's more in line with hip arthritis. Same thing with range of motion pain. A neurologic exam is not really helpful. I put this picture in here of a person leaning on a shopping cart because spinal stenosis is very positional. If someone is leaning forward for a certain activity, they'll often say that it feels better. So the textbook answer is, oh, I go to the grocery store and I feel better when I lean forward on the shopping cart. Imaging studies can be helpful but not definitive. So an MRI can show, normally this is an ellipse, but here you have a small little triangle. That's evidence of spinal stenosis in the spinal canal, okay? Okay, so a diagnostic injection can be very, very helpful. So if you have a diagnostic injection performed into your hip joint, and the hip is the source of the problem, then it should decrease the pain within minutes, all right? If you have an epidural injection, and the problem is spinal stenosis, it should relieve the pain instantaneously, but it may actually take a few injections to get to the most relief possible. Here's the potential outcomes, all right? Complete hip relief with a hip injection, that means you have a hip problem, all right? You have the injection, the pain goes 100% away, even if it's temporary, that's the issue. If you have complete hip relief with an epidural injection, that means you have a lumbar spinal stenosis problem. If you get some relief from the hip injection with the rest of the relief from an epidural injection, that means you have both. And that's not uncommon to have both hip arthritis and spinal stenosis causing symptoms. All right? And there's always the possibility that neither injection will work very well. In that case, you have to do further investigation to figure it out. The top non-operative pain management in the Chicago metro area is with Premier Pain Specialists. There are several clinics throughout the metro area accepting over 50 insurances and providing over 25 treatment options with the board-certified, award-winning doctors. Visit us online today at ppschicago.com and then call us for more information and scheduling at 847-519-4701. Thank you very much for watching today.